Thank you for the nice introduction. And Megan already said I cannot add more. I want to thank so much to the Cancer Foundation. Your funding is absolutely critical for my lab and for my research. I will show you why I said that, because without your funding, we definitely cannot reach to these stages. Now we have a paper and a review of Nature Communications. So I will tell you our lab's progress, and how can I change this to my slides. So I'm going to talk about the chromatin structure driving epigenetic therapy in myeloid neoplasm. Maybe just give you a nice background and the importance studying myeloid neoplasm, because this is one of the lethal disease and we don't have a good treatment for this disease. And this, actually, I'm studying two diseases. One is called myelodysplastic syndrome, another is acute myeloid leukemia. MDS, myelodysplastic syndrome, is so-called syndrome, but it's deadly disease. When you diagnose myelodysplastic syndrome, and average lifespan is only 3 years, so it's one of the most common deadly disease in elderly. So now we have tried to develop new strategy to diagnose and treat those patients. So Megan talking about the genetic abnormality in the myeloid neoplasm, but I want to emphasize another point. There's no such things without epigenetic or without genetic. Both are connected. But another thing is at the top is genetic disease can be treated epigenetically. I will tell you about this. So overall, long-term goal of my research project is to elucidate the mechanism governing sequence Locus-specific or disease-associated chromatin organization and drug sensitivity and efficacy. To understand the interplay between the lineage-determining transcription factors and epigenetic modifiers in pathogenesis, MDS, and acute myeloid leukemia. And eventually, we're going to develop chromatin structure-based diagnostics and therapeutics. How we started working on this? That's back to several years ago, when actually I was resident in the pathology. I studied first epigenetic profiling in MDS. What we did here back in 2006, that was first epigenetic profiling in MDS. So I took the normal bone marrow from normal patient, and also took the bone marrow cell from MDS patient bone marrow cells, and isolated DNA, and used two antibody development technique to use this called a cross-linked assistant chip assay to looking into both histone and DNA methylation. And at that time, there was no sequencing, genomic sequencing available or affordable. So the only things available at that time is promoter array, genomic array from Nambo-gene. So you can see I label those DNA from normal and label those DNA from MDS patient hybridized to the same chip. So I can compare this, what kind of peak is above the background of normal. You can see this all the peak here from chromosome 1 to chromosome 20. And then we did the computational analysis to see what kind of promoter or what kind of sequence being enriched in the MDS patient. there was only 3 motifs, DNA binding motifs, are enriched in those hypermethylating peaks regions. What are those motifs? First one come out, the PU1 or SPI1, which is the most important transcription factors for the myeloid or granulocytic and monocytic differentiation. If you lost PU1, you lost all the granulocyte, monocyte, but erythroid cells actually are not affected at all. Another motif come out is p53. We all know p53 is one of the most important tumor suppressor gene. Another motif come out is MYB binding motif. This is another myeloid determining factors. So our data first demonstrate this is epigenetically inactivated. Those key transcription factors plays an important role in the pathogenesis of myeloid neoplasm, MDS. So you see, it took a long time to get this published because I did not have funding at that time. The first question I was asked by the reviewers, we should do the genome-wide sequencing. But at that time, I even did not have any money for sequence one patient. How can I do that? So this becomes, I think, this foundation so much because it really enabled me to move my project ahead. So next question is, now we back to a couple of years ago. So another thing is we know this transcription factor, which is determines the myeloid lineage, P1 is important, but how the lineage specification affect therapy, especially epigenetic therapy. So you can see here, there's 2 different myeloid leukemia. Red one is erythroid leukemia, and the blue one, SC, is monocytic leukemia. So this is well-known DNA hypomethylation drug, azacitidine. You can see there's not much difference actually, quite close. But when we treat another drug, this drug specifically inhibits H3K4 methylation, which is histone methylation, and which is leading to 10R gene expression. You can see this dramatically difference in terms of drug responsive in these leukemia cells. This erythroid leukemia just did not respond to this drug, but the monocytic drug, just cell lines, is very sensitive. The next question is asked, why? How this could happen? So now we look into this. We did the co-immunoprecipitation, which is use antibody to pull it down or to detect what protein expressed. Let me show you this. This erythroid cell line. We already know that this GATA1, which is key transcription factor for erythroid or megakaryocyte differentiation. This we already know is highly expressed, but not in monocytic cell line. We already know that. People already know this very well. And monocytic cell line express PU1. You can see it at high level, but erythroid cell line express very low level of PU1. But the next question is, we want to see what factor or protein associated with this 2 transcription factor. Very surprising. You can see here, in this erythroid cell line, this GATA1 is associated with TET2, but not associated. But in the monocytic cell line, here, the TET2 is associated with PU1. So, and this is summarize this interaction of those key factors. So this is a selective association between the transcription factor and the epigenetic modifiers. And when we treat these cells, actually we use this called 3C technology to visualize the chromatin structure. Actually, this chromatin kind of changes just opposite directions. And we can also use this high resolution image. We can monitor those transcription factors colocalization with these epigenetic modifiers. So this could be potentially the new diagnostic tools. So important question we need to answer is next. We want to elucidate the interaction domains so we can design the more effective drug to stop leukemia cell proliferation. Or even we can reprogram these cells into different lineage for different therapy. Also, we want to identify novel mutation and underline those leukemia cells, especially in those drug-resistant leukemia cells. Of course, eventually we're going to develop the new treatment and the new therapeutic tools based on the chromatin structure. Let's stop here. Thank you for this opportunity.